Whenever you're ready, just say chapter 9.
Chapter 9, Disinfection. Learning objectives. As a result of successfully completing this chapter, readers will be able to 1. Define the term of disinfection and explain how disinfection differs from sterilization. 2. Explain disinfection levels as identified in the Spalding classification system, which are low-level disinfection, intermediate-level disinfection, and high-level disinfection. 3. Provide basic information about the types of disinfectants commonly used in healthcare facilities, which are quaternary ammonia compounds, alcohol, phenolics, chlorine, iodophores, glutaraldehyde, ortho-phyllaldehyde, hydrogen peroxide, and peracetic acid. 4. Identify good work practices for manual disinfection process. 5. Discuss automated equipment utilization for disinfection and the good work practices for working with automated disinfection process. And finally, 6. Explain disinfection quality assurance practices. Introduction. Once an item has been properly cleaned, there are some decisions to make. Is the item safe for its intended use, or does it need further processing? If further processing is needed, what type of processing does it need, and how can that be accomplished? See Figure 9.1. Central service technicians must be able to identify the type of bactericidal process, sterilization or disinfection, select the method that will provide the process, and perform the process effectively. Sterilization process are examined in later chapters. This process will provide basic information on disinfectants and disinfecting process that are frequently used in the CS department. Introduction to disinfectants. The Spalding classification system. The selection of a disinfectant must be based in part upon the intended use of the device and the degree of disinfectants required for the device. The Spalding classification system divides patient care items into 3 categories, each based on the degree of risk of infection when the items are used in patient care. The Centers for Disease Control and Prevention, the CDC, and the Association for the Advancement of Medical Instrumentation, AAMI or AMI, use the Spalding classification system in their guidelines and standards. See Figure 9.2. The 3 Spalding categories are as follows. Critical items. Instruments or objects introduced daily into the bloodstream or into other sterile areas of the body. Examples include surgical items, cardiac catheters and implants. These items must be sterilized before use. Disinfection is inadequate. Semi-critical items. Although these items come in contact with the intact mucous membrane, they do not ordinarily penetrate the body's surface. Examples include non-invasive flexible fiber optic endoscopes, endotracheal tubes, anesthesia breathing circuits as examples. Semi-critical items should be subject to a high-level disinfectant process that can be expected to destroy all microbial organisms, but not necessarily microbial spores. Non-critical items. These items usually come in direct contact with the patient's unbroken skin. Examples include crutches and countertops. These items require thorough cleaning and in some cases, low-level disinfection to intermediate-level disinfection. Definitions. Bactericidal, relating to the destruction of bacteria. Sterilization, the process by which all forms of microbial life, including bacteria, viruses, spores, and fungi, are completely destroyed. Disinfection, the destruction of nearly all pathogenic microorganisms on an inanimate object, which is a non-living surface. Disinfectant, a chemical that kills most pathogenic organisms but does not kill all spores. Spalding classification system. a system developed by Dr. E.H. Spalding that divides medical devices into categories based on the risk of infection involved in their use. Sterile or sterilization, completely devoid of all living microorganisms. High-level disinfection, the destruction of all vegetative microorganisms, microbacterium, small non-lipid viruses, medium or lipid viruses, fungal spores, and some bacterial spores. Low-level disinfection, the destruction of vegetative forms of bacteria, some fungi, and lipid viruses, but not bacteria spores. Intermediate level disinfection, the destruction of viruses, microbacteria, fungi, and vegetative bacteria, but not bacterial spores. There is no single disinfectant that will work for all situations. That is why every decontamination area has more than one disinfectant to choose from in the work area. CS technicians must be able to select the appropriate disinfectant for the job. To do so, a basic understanding of the different types of disinfectants is needed. Understanding chemicals. Central service professionals work with a wide variety of chemicals every day. While the disinfectants used in healthcare facility may be a type of disinfectant, they all work differently to perform some different tasks. CS technicians understand the different disinfectants they work with and know how to achieve desired results. Types of disinfectants. The term disinfection is a generic term that is used to describe a process. Within that process are products that perform at different levels. See figure 9.3. The following is a review of common disinfection used in healthcare facilities and the level or type of disinfection they are designed to provide. Low-level and intermediate-level disinfectants. Items requiring low-level or intermediate-level disinfection only come in contact with intact skin. These items usually only touch the outside of the body. This includes items like crutches and countertops. These disinfectants may also be used on hard environmental surfaces in some mobile equipment. This group of disinfectants commonly includes quaternary ammonia compounds, alcohols, phenolics, chlorines, and iophors. These low-level or intermediate-level disinfectants have one important thing in common. The germicidal action of each is reduced by the presence of organic materials. See figure 9.4. I'm going to read figure 9.4. Summary of quats. Advantages. Bactericidal, fungicidal, and virucidal against lipophilic viruses. Wetting agents with built-in detergent properties. Disadvantages. Non-sporicidal. Generally not tuberculocidal or virucidal against hydrophilic viruses unless multiple compounds are included. May be inactivated, absorbed, or neutralized by cotton or charcoal. Non-compatible with soap. Not effective against some gram-negative organisms commonly found in hospitals. Deactivated by organic material. Uses. Environmental sanitation of non-critical surfaces such as floors, walls, and furniture. If multiple compounds in solution, superquat may be used on instruments if properly rinsed. Must remain wet on surfaces to be disinfected 6 to 10 minutes, according to the manufacturer's instructions for use. Definition. Organic materials. Compounds containing oxygen, carbon, and hydrogen derived from living organisms, organic matter, in the form of serum, blood, pus, or fecal material can interfere with the activity of these disinfectants. Quaternary ammonia compounds. Quaternary ammonia compounds, as I just read in the summary of quats, highlighted in blue, which is 9.5, are low-level disinfectants. The most common chemical in most quats is benzyl canomian chloride. Quats are incompatible with soap. Soaps are not recommended for use in the CS decontamination process because of the residues they leave behind. Some quats are absorbed by materials such as cotton and filter paper. A quat that is absorbed by cotton should not be used with cotton towels, cloths, or mop heads. It is important to consult the specific quats instructions for use to determine if the cotton and/or paper can be used with them. Again, figure 9.5 reviews the basic information about quats highlighted in blue at the bottom of page 164.